Hello guys, welcome back to another video, and as you have read from the title, today I would like to talk about something more serious which is affecting our daily lives, the COVID-19, and in specific how Sweden has dealt and is dealing with it. First of all, I would like to specify that I'm not a doctor, I'm not an expert. I've been not studying medicine in my life. My major at university is business and management. So this is just my perspective and my point of view as an European citizen living abroad. The COVID-19 is defined by the WHO, the World Health Organization, as an infection disease caused by a newly discovered coronavirus. The Center for Disease Control and Prevention, CDC, defines coronaviruses as a group of viruses which have symptoms similar to a flu, so runny nose, sore throat and fever. The coronavirus gets its name from corona, which in Latin means crown. Indeed, if observed at the microscope, it has these spikes around, which look like a crown. Being Italian and knowing that my beloved country has been heavily affected by this virus has really made me take this situation really seriously. At the beginning, I really couldn't understand why after China, the most affected country in the world was Italy. Receiving notification on my phone from an Italian newspaper about the increasing number of cases and consequently of the increasing number of deaths has really been an eye-opener for me. I took every possible precautions in order to prevent to get infected. Mask and sanitizers, washing my hands as many times as possible, keeping the distance and obviously avoiding overcrowded places. When I came here in Sweden, the situation was very different. There was no lockdown, the masks were not mandatory, just few suggestions to avoid overcrowded places and to keep distance. Although some people think that Sweden didn't put in place a lockdown to save its economy, the Swedish authorities insist that their strategy was aimed at the public health. Indeed, the finance minister Magdalena Andersson stated that the government didn't have any economic consideration when they decided which measure to take to avoid the spreading of the virus. But from the other side, the authorities also stated keeping business open was part of a broader consideration because an high rate of unemployment could lead to a poorer public health. I obviously don't know why the Swedish authorities didn't take another approach about this pandemic, if it was because they considered the economic side or because they considered the public health or probably both. What I know though is that according to local.se, a Swedish newspaper, the Swedish economy has fallen just like any other country in Europe. From a business perspective, this is because the world nowadays is connected, is globalized. Every country is connected to another one or to multiple, and when something happens, there is very often a domino effect. Multinational companies buy supplies from one country and sell their products to other countries. That is why if there is no demand in Europe or in the world in general, it doesn't matter if you put in place a lockdown or not to save the economy, it will decline anyway. Companies like Volvo, Tetra Pak, SKF and Electrolux, some of the biggest Swedish brands, are slowing down their hiring process and sometimes are making employees redundant because they are multinational companies. They cannot survive to sell their products only in the Swedish market. Citizens and the government itself are starting to wonder if not having another approach on the COVID-19 to not put a lockdown in place was a wise decision. Indeed, as stated in the Business Insider, the Swedish Prime Minister Stefan Löfven has ordered an inquiry into the country decision to not impose a lockdown after Sweden suffered 1,000 more deaths compared to Norway and Denmark. The other two countries have had another approach on this pandemic and they managed to contain the number of infected people and consequently the mortality rate. As of today, Denmark counts almost 2,300 cases every 1 million people. Norway counts almost 1,700 cases every 1 million people, while unfortunately Sweden counts the highest rate with 7,500 cases every 1 million people. I think that they underestimated the seriousness of this pandemic, and now they are paying the consequences of their decisions. I personally will feel safer in a country that took this situation a bit harder and a bit more serious. One last thing guys, this virus is not a joke. As of today, there are 14 million cases worldwide. Please follow the guidelines of your local authorities. Use masks and sanitizer, keep the safe distance. We are all in this together and this gonna end soon if we do our part. Stay safe and take care of yourself, both mentally and physically. See you soon.